Hello everyone, good afternoon. I'm presenting a talk on environmental hazards and its effects on pregnancy. So, next slide. Okay, so coming to introduction, we first we will know the term of environmental hazard or pollution, what it is. So, a hazard is a danger or risk, and environment with respect to neonate is the prenatal environment, which covers the baby fetus. So, environmental hazard can affect the health of pregnant women and the developing baby severely, and like chemicals, radiations, air pollution, and extremes of heat, humidity, and any change in climate also plays role. Like now we can see in winters, the polluted particles are suspended in air. So it is very, the air is very, like air quality is very high. So coming to next, these environmental dangers can affect the baby uh, in prenatal stage. Like we can see in the picture, the baby is surrounded by a amniotic fluid first, and it is protected by the uterus wall. And we can see here placenta that which transports the nutrients and other supplements from mother to baby through this umbilical cord. And next slide. Okay. So coming to next, we here this is a pictorial diagram which shows the flow of contaminants and pollutants from environment to the baby. So here we can see the pregnant ladies, some in rural India. The pregnant ladies work in some construction sites or some mines or silica construction, or they are in their own home they are using these fuels, firewoods, which are releasing carbon monoxide. So these are taken by the pregnant ladies, and which transports to the blood. As we all know that blood have hemoglobin, which transports oxygen as well as carbon dioxide. So these pollutants and contaminants travels to the bloodstream of the mother first, then it goes to the passes to the baby via placenta and umbilical cord. So next slide. So coming to environmental hazards, we will know about the factors and how it affects both mother and the child. So first, it is chemicals like lead, mercury, selenium, and pesticides, solvents, products containing chlorine, organic pollutants. So lead and mercury are known as heavy metals. So fetal exposure to heavy metals like mercury can result in severe damage in nervous system, and these can be taken by the mother. Like if she is working in any chemical industry, she might get lead or mercury exposure, or she is taking a normal polluted like pesticides sprayed vegetables or fruits. So it enters mother, and then it enters to the baby also. So it results in congenital anomalies, stillbirth, or miscarriages. Here I would like to tell you the difference between stillbirth and miscarriages. Stillbirth is when the baby dies inside the uterus after 20 weeks of pregnancy, and in miscarriages it is 12 weeks of before 12 weeks of pregnancy the baby dies. So it also results in premature birth, low birth weight, delay in developmental milestones like intellectual difficulties, birth defects, and also it affects babies' behavioral and cognitive skills. And the chances of lung cancer also increases. There's a chance of genetic mutation itself in the gene level. Okay, so next slide. Here I would like to show you all a picture of baby with abnormal, not normal body structure physically. So here we can see in the picture the head is somewhat not normal. Like normal child have a round head, but here we can see the head is not properly formed. It is all deformed. So these are some effects. Coming to next slide. So let's talk about another factor, that is environmental tobacco smoke, cigarettes, nicotine, carbon monoxide, tar exposure, silica exposure. These all are not intaken by directly by the mother, but we can expect that her partner is a regular smoker, or she is living in a very polluted city. So this might cause a risk of polluted pollutants to be get inside her, and which it results in miscarriages and congenital disorders like sickle cell disease, Down syndrome, and low birth weight, respiratory problems. First, it will affect the mother, and then later we can expect that later child may also have that asthma problem and wheezing, pneumonia. The complication of silicosis infects leading to infections like pulmonary hypertension, chronic cor pulmonale, uh, and heart diseases, also chronic respiratory failures, and these are very much affected. In rural areas, it is mostly seen. So, next slide. Okay, so next we will talk about cosmetics and skincare products, teratogens, medications, alcohol, anti-neoplastic drugs, perfume, cleaning supplies, cooking fumes, and mold. We all know that the only not this air is not only the only thing that is surrounded, but all these cosmetics that is used, or the perfumes, or the cooking fumes, or the mold, the fungi, these are also affecting uh, this child. So what are the effects? So first it is preterm delivery, or drug like promethazine, which is helps to control severe nausea and vomiting. Its excessive use can affect platelet function of baby, and cancer of risk cancer also increases. It is found that some researchers have found that baby may born with addiction also, and fetal alcohol syndrome, allergic reactions from these cosmetics and care products also develop. So next slide. So here in the picture, we can see that the child is having a microcephaly condition. Microcephaly means micro, that means small, cephaly related to head. So here the head is smaller than usual. Here in lower picture we can see the real picture. Here also it is shown, but left and right picture, the child is having a megacephaly condition where the head is bigger than usual. Then in the upper lip portion is very thin, and micrognathia means the jaw is very small, and nasal bridge is very wide, and we can see the epicanthal folds on the eyes, and the philtrum is the region below, just below the nose, that is very smooth. So, and minor ear anomalies also happens, which can affect later in life, like in hearing impairment also can happen. So, coming to next slide. Okay, so another factor is air pollution or noise pollution, or exposure to radiation such as cell phone or laptop or toxic waste. So these some pregnant women also are exposed to phone and laptop nowadays. Like working women are mostly affected like this. And what are these effects? First is fetal immune system is affected. Then preeclampsia. It is a pregnancy-induced hypertension, in which results in intrauterine growth restriction. Then it can result in retardation in growth, stiffness of lung, malformation, risk of autism and learning difficulties increases, underdeveloped brain functions, chances of miscarriages and birth defects. For example, we have seen the Chernobyl nuclear accident where radioactive reactor got burst by accident, and and also Hiroshima and Nagasaki bomb blast, where this radioactive element uranium was the cause. So coming to next slide, we can see here how these infants are affected. Like we can see in the picture, like these upper limbs of the child are very underdeveloped and very small. So these are some these are infant born to mothers pregnant during this accident at Chernobyl. In the lower pictures, we can see the legs and hand, where this condition is known as webbed toes and fingers. Uh, Coming to next slide. Here, I would like to show you one video or documentary.
A study in 2015 conducted by Sir Gangaram Hospital in association with Public Health Foundation of India, Indian Meteorological Department, shows that the poor air quality even affects the growth of fetus in pregnant women, and has explored the association of air pollution with a neonate's birth weight and gestational age.
For a pregnant woman, you have to consider the mother and child as one unit. So if the mother actually has asthma, let's say, or has hypertension, so their increased risk of having very bad outcomes, being hospitalized. So being exposed to high levels of air pollution is going to be very bad for her. So we still don't know what the real mechanisms are on how it affects the fetus, but we've noticed some association with prematurity and also having lower birth weight.
Studies globally also show a correlation in air pollution and fetus in the womb. The Environmental Protection Agency says that prenatal exposure to pollutants can increase the risk of preterm delivery and low birth weight. A study conducted by the Harvard School of Public Health in June 2013 revealed a connection between exposure to high levels of pollution during pregnancy and autism. Researchers at Columbia University in March 2015 found a correlation between exposure to air pollution during pregnancy and the development of behavioral issues like attention deficit hyperactivity disorder and obsessive compulsive disorder. There is growing evidence that exposure to air pollution before conception or even during the first month of pregnancy increases the risk of birth defects in children. One of the major reasons for low weight among newborns in rural India is the continuous exposure of pregnant women to indoor air pollution caused by firewood and coal used for cooking.
Whether the woman is in rural or in urban India, whether she is indoors or outdoors, every pregnant woman is uniformly affected by the hazards of the air pollution. The principal problem is about the smoke or the particulate matter clogging the blood vessels.
While the government is taking steps to control pollution, what also is required is proper, efficient implementation of plans and programs and policies launched by the government. But we need to think about the pollution we are passing to our future legacies.
Okay, so here I would like to conclude this session with some conclusions. Like we all know, there are so many environmental influences in prenatal development or in general, but we cannot escape entirely. But we can at least can minimize the effects, like avoiding harmful medications or environment conditions or crowded place or noisy place, or any other exposure to hazardous substances, and there are some do's and don'ts for pregnant women. So avoid going out in crowded place, avoid walk during early mornings or late evening, use a good air purifier in home, use gym or a treadmill, stay hydrated, and take organic foods. And sustainable development goal also has some goals, like number 6 is clean water and sanitization, and 15 focuses on life on earth, which focuses on all human aspects like petroleum and roads, everything, and 13 which focuses on climate action. So I would like to end this session with a small video clip. Um, Next slide. Okay.
Hello, I'm Dia Mirza, and all through my pregnancy, I smoked. Actually, I didn't, but it doesn't really matter because my unborn child and I are a part of the 90% of the world who breathes polluted air. Breathing in Indian cities has been equated to being a regular smoker. WHO tells us that air pollution kills about 7 million people worldwide each year. In India alone, there were as many as 980,000 deaths in 2019 because of particulate matter. But these are numbers. Statistics don't touch us. Data doesn't shake us. We hear numbers, but we're moved by stories. So here's a true story. My own pregnancy was complicated by a bacterial infection, and my extremely prematurely born baby stayed away from me in a neonatal ICU for months from birth. I do not know what caused the infection, but I know that many millions of mothers worldwide with far less privilege than I have routinely suffer from complications during their pregnancy because of the toxic environments we live in. For the mothers and to those expecting here and at home, how do you feel to know air pollution particles have been found on the fetal side of placentas? That even unborn babies are exposed to the dirty air produced by motor traffic and fossil fuel burning? And what happens when our babies arrive in the world? Our children are born into a world in crisis. The IPCC report, the most comprehensive study to date, says it's code red for humanity. My baby is now a part of a planet where temperatures are rising by the day. Heat waves and other extreme weather events arrive unexpectedly and with more intensity. Avyan was born into a world where water, soil, and air can all be poisonous. Avyan is not just statistics. He has a face. The 67,000 or so other Indian babies born with him on the 14th of May aren't just numbers. They look like you and me. When we say we want a better future for our children, we cannot escape the question of what we are doing today, right this minute, to fix it. As a mother, I worry about this and what tomorrow will bring.
Okay. Thank you.
Very nice presentation it was.
Thank you, ma'am.
The recording is not stopped. You please try to stop. Maybe I have started, but it is not getting stopped.